everyone. Today, Aurélie from the Luxembourg Institute of Health and I will be presenting together to share our collaborative work on the Long COVID Companion app. This project combines patient and research expertise to address the needs of long COVID patients. I'm both a patient and a researcher, and I speak on behalf of Après-Givin, the French association dedicating to amplifying the voices of the long COVID patient to gain recognition, improve care, and advance research. Over the past 4 years, we have worked to ensure that the needs of long COVID patients are heard and prioritized, as many of us still lack adequate care. Patients, and that we need not to forget, play an essential role in research, especially in tracking symptoms, managing care, and ensuring studies are truly adapted to patient cognitive difficulties. Our partnership with the Luxembourg Institute of Health began on Twitter in 2021 when we reviewed their early work on long COVID to ensure it really aligned with patient realities. This partnership soon grew into a thesis project and, more importantly, into the co-design of the Long COVID Companion app. Our association, Après-Givin, was deeply involved in every step of development, identifying patient needs, designing interview guides, choosing features like symptoms tracking and voice recording, and rigorously testing the app to make it user-friendly. This participatory approach helped us build a tool generally adapted to the complexity of long COVID, a multisystemic and fluctuating condition. Our collaboration between patients, researchers, and healthcare professionals has allowed us to create more than just an app. It's a step forward, aligning research with real patient needs. We hope this free app will support patients in managing symptoms, but also open doors to innovative research on voice biomarkers that could deepen the understanding on long COVID. We are deeply committed to refining this app so it remains valuable for patients and as a research tool. We hope this app will keep evolving to support even more patients worldwide. And last, I really would like to thank you, Aurélie Fischer and her team, for their dedication to this collaborative effort. And with that, I will pass the floor to Aurélie Fischer. Thank you very much.
Good afternoon, everyone. After this nice introduction from Pauline, I will explain you concretely how we set up this co-design study. So we involved patients and healthcare professionals at each step of the study to ensure to develop a useful and clinically relevant solution. First, we conducted an online survey to assess needs, fears, and expectancies regarding a digital app. Then we conducted semi-structured individual interviews to further discuss survey results and to define app characteristics. And finally, we conducted a focus group to collect feedbacks on a first app prototype. With this study, we showed that long COVID impacted the life of patients on several aspects. For example, on the daily life, with a high level of fatigue, lack of energy that induce inability to perform daily tasks. Also impact on the medical side with some difficulties to access specialized long COVID care, to obtain a disease recognition or a long COVID diagnosis. But also long COVID impacted social life and work life. It was also very important to us to see that almost 78% of the patients declared that they were very interested in a digital app to monitor their health. And also 78% of healthcare professionals declared that this kind of application could be useful for their patients. In terms of expectancies, They were to obtain a better symptom identification and monitoring, to reduce the number of medical visits, to improve communication between patients and healthcare professionals, and finally to receive evidence-based information or advice. Based on these results, together with Après-J20, we developed the Long COVID Companion app with 3 main features. The first one is the symptom monitoring part that I will explain you just after, more in details. Then a medical and daily life diary in which users can report important medical and daily life events. And finally, a resources model with information on long COVID, patients association contact, and specialized long COVID care contacts. So this is the Long COVID Companion app. In this app, the users can do a daily monitoring of their health or at the frequency they prefer. They can choose a symptom they are suffering from in a list of more than 60 symptoms grouped by symptom category. And for each symptom, they can indicate at which intensity they are feeling it. In addition, they can complete standardized questionnaires for some specific symptoms like fatigue, anxiety, or dyspnea. And they can generate graphs of symptom evolution over time in correlation with events reported in the diary, so they can see potential correlation between symptom relapse or improvement and an event. They can also generate PDF reports that they can share with their healthcare professionals. The app was released in April 2024, and as of end of October, it counted around 1,200 users, the majority being women, and majority of them being based in France, Luxembourg, Belgium, Germany, or Switzerland. And for now, the app counts more than 50,000 symptoms and around 6,000 questionnaires already completed. To conclude with this project, we developed, to our knowledge, the first app really dedicated to long COVID, which is widely available. The app has been designed by and with patients in a full co-design project. The app is freely available as a web application and will be soon available on iOS and Android stores. And finally, the app users are constituting a virtual cohort of people with long COVID for research on long COVID in the future. However, not all the expected functionalities could be implemented in this first version, so we keep working with Après-J20 to implement further improvement. And finally, there is a need to evaluate the potential app use benefits for the app user health. If you want more information, just visit our website longcovidcompanion.org, and to access the app, you can flash the QR code here. And I thank you for your attention.